the government remains shut down primarily due to a dispute over healthcare. Now, the right is blaming the shutdown on the left and vice versa. The right are making claims that Democrats want to fund Medicaid services to illegal immigrants.
What they're asking for is a $1.5 trillion rollback of the fraud, waste, and abuse Medicaid cuts that we made in the reconciliation package this year, in addition to $200 billion worth of healthcare spend for illegal immigrants. I mean, that's
part of what he does in his bill is he repeals the verifications on illegals getting free healthcare. So on one hand, they'll point to the law and go, don't worry, the law says illegals can't get free healthcare. But in the bill that Chuck Schumer is demanding that we pass to open the government up, he repeals the verifications.
This is a shutdown that was initiated by Chuck Schumer, John Ossoff, and the Democrats in the Senate. And it has been at the expense of our troops who are not getting paid, and in the name of them trying to make sure that illegals get health care here in America.
Now, let me make this clear. Yes, immigrants technically do receive health care, but it might not be in the way that you think it is. Also, if Republicans get their way, this could directly impact you, a U.S. citizen. For all you MAGA turds, let's get this out of the way now. Due to the Personal Responsibility and Work Opportunity Act of 1996, undocumented immigrants are not eligible for federal healthcare assistance programs, such as Medicaid, Medicare, or the Children's Health Insurance Program, also known as CHIP. They also aren't eligible for insurance on the Affordable Health Care Act either. Illegal immigrants can purchase private health insurance through their employer. However, no one would consider that mooching off Americans because they are paying their fair share. Now, this is important. Lawfully present immigrants, which includes, but is not limited to, green card holders, asylees, temporary visa holders like J1 or H1B visas, or victims of trafficking or abuse, can be eligible for Medicaid after a 5-year waiting period. Again, those are lawfully present immigrants, not illegals. Now, there are 14 states that use state-funded subsidies for qualifying illegal immigrants to receive Medicaid or Medicaid-like care. Those states are California, Colorado, Connecticut, Illinois, Maine, Massachusetts, New Jersey, New York, Oregon, Rhode Island, Utah, Vermont, Washington. Each state uses its own subsidies in a different manner, and that manner typically reflects the needs of their patients. California's program, Medi-Cal, recently expanded in 2024 to include all undocumented low-income immigrants. Now, that's a stark contrast from other states on this list, which only provide either limited services or services for a limited population, such as pregnant women or children. The toilet bill, the Big Beautiful Bill initially proposed reducing Medicaid funding for these states. However, that proposal was removed from the final version. Now look, I'll be honest with you. I kind of don't care about what individual states do for illegal immigrants because they don't use federal taxpayers' money. States have autonomy to do what they want. Now, if you have a problem with that, take it up with your state. Now, where most illegal immigrants receive care is through the ER. Yes, illegal immigrants receive emergency medical services through Emergency Medicaid, which is a joint federal state-funded program that provides funding to the states for unauthorized illegal immigrants who would have otherwise been eligible for Medicaid. Authorized immigrants who took residence in the U.S. within the last 5 years are also eligible. This funding is in response to a federal law called the Emergency Medical and Treatment Act, also known as EMTALA. EMTALA was implemented in 1986 to prevent patient dumping, i.e., the ability for hospitals to turn away or inappropriately transfer patients. Now, there are 3 requirements for any Medicare-funded hospital. 1, an ER has to provide an appropriate medical screen for every patient. 2, the ER is expected to treat patients with medical emergencies regardless of their citizenship status or ability to pay. 3, you can have an appropriate transfer to a hospital if you need it. That's the bare minimum. Now, here's where things get tricky. The states are allowed to decide what counts as a medical emergency. For instance, some states use emergency Medicaid to help fund routine dialysis for undocumented illegal immigrants. Now, while I understand how people could take issue with this, it's a nuanced issue and makes more sense from a medical perspective. There are some illnesses that are perpetually emergent. End-stage kidney disease is a great example. People on dialysis can't urinate, which has consequences, guys. You can become volume overloaded, you can become encephalopathic. There are a lot of acute consequences that can occur with that. Now, an undocumented immigrant likely won't receive a kidney transplant, which is the definitive management of end-stage kidney disease. And if those patients don't receive routine dialysis every 2 to 3 times a week, they will undoubtedly end up back in the ER for emergent dialysis routinely, or they just die. It's very, very cut and dry. Plus, routine dialysis is actually more cost-effective than dialysis through an ER visit. So that helps both the states and the government. Finally, think of it this way. For all you selfish losers out there, everyone has to be treated in the ER because of EMTALA. The more immigrants are in the ER, the more likely you, a U.S. citizen will have to wait to be treated. But wait, how much do illegal immigrants actually burden the Medicaid system through the ER? The answer is not much. Total Medicaid expenditures have amounted to over $500 billion annually between 2017 and 2023. Yeah, that's a lot of money on healthcare. Between that time, Emergency Medicaid for illegal immigrants accounted for less than 1% of Medicaid during that time. Oh, and wait, that includes authorized immigrants who gained residence within 5 years. So yeah, if illegal immigrants can't use federal assistance medical services, can't use Obamacare, and can either live in a state that provides healthcare services for limited populations or buy their own private insurance, how else could they burden the healthcare system? Stupid. Now in the turd dump bill, the big beautiful bill, Trump planned to end additional Medicaid funding for undocumented immigrants to receive emergency Medicaid. Additional funding was granted in 2021 as a means to alleviate the increasing enrollment in Medicaid during periods of economic downturns, for instance, during the pandemic. Unfortunately, Medicaid enrollment continues to rise. Inflation is increasing and drug costs are skyrocketing. This means more people will continue to enroll in Medicaid. As a result, many states are having more difficulty funding Medicaid. Removing enhanced funding forces states to use additional state funding in order to abide by EMTALA. This would lead to lower Medicaid payments and would result in lower reimbursement payments to providers. And as a result, it would be even more difficult for states to pay for Medicaid. Now, some MAGA turds want to end EMTALA altogether. If EMTALA didn't exist, it would need to be amended or removed in order to stop funding to illegal immigrants. Not only would this be dumb, but it would be unethical and against the values of America. It would force ER physicians to implement unethical methods to identify which patients to treat. Guess what? Patients often present in the ER without identification. Some aren't even in a position to communicate, whether they're in a coma, intubated, or encephalopathic. Imagine telling an ER physician,
if they can't prove that they're a citizen, or if you think a citizen is an illegal immigrant, just refuse their care. In fact, drop them off at the entrance to the ER bay and have the chaplain pray for them. And bill them for it.
What? Imagine an ER physician providing care to patients based solely on the color of their skin. What if that happened to you? Imagine if that were you. Imagine if you were drunk, got very, very intoxicated, drunk out of your mind, became acutely altered, and didn't have your wallet. And because of that, an ER physician deemed you an illegal immigrant and refused to treat you. That's what MAGA wants. They don't want illegal immigrants to have basic human rights, such as the ability to perform CPR on an immigrant who's dead. It's disgusting and goes against every core value among the so-called Christians.